I'm Dr. Joe, sports chiropractor and clinic director here at Full Function Rehab and Wellness. This is our third video series regarding concussions and how we diagnose a concussion. So most of the time when patients present to our office, they are presenting with a lot of symptoms. So we give them a general checklist that they grade from 1 to 6, which is the severity of what their symptoms are. They go through those and then we ask them questions regarding their symptoms as far as what's happening, when it happened, how long it's been happening, and how bad they're really feeling. We go through each process, we understand the basis of where they're feeling the pain, the severity of their pain, and their overall process and their history of how the concussion took place. Whether it was a sporting injury, a car accident, slip and fall, anything like that, we need to know to get a better idea of how the brain reacted, or most commonly as well, how the neck reacted with the concussion. So after that, we go through a bunch of testing procedures. Within the brain, we have 12 specific nerves that actually come out of the brain, go into our face, control our eyes, control our nose, and control our different aspects around our face and neck. We try and test those individual nerves, and they're called cranial nerves, to make sure there's no compression on there, or fluid around there, or bleeding in the brain that's causing any irritation or difference of normal symptoms. So once we rule that out, then we look into the overall function of somebody. We test their balance, we test their vision, we look at how their eyes are reacting to movement. We move their neck to test their balance and their equilibrium. We move their head in different positions to see what is a trigger. We turn lights on and off to determine how the eyes are most sensitive to light or no light. So there's different things that we do as to determine the symptoms and the severity. Another thing that we like to check as well is to see how the brain is actually firing. So most of the time we get a subjective reasoning from a patient, how they're feeling, their mental cognition. But we want to have more factual data, which is why we use computer tests, which are neurocognitive tests, which test them on reaction time, speed of transmission, memory, things like that, so we get a better idea of how quickly the brain is firing or how damaged the brain may be. Now that doesn't have to be physical damage, but neurochemical damage. That's causing the brain to fire at a lesser rate, leading to increased symptoms and development of this concussion itself. So we follow a certain protocol, a certain regimen. We take general precautions on heart rate, we check balance, we do all vital signs, just to do a full workup on a patient, to give them a better idea of what we feel if the patient has a mild, moderate, or severe concussion. And following that, we give them protocols to follow at home for rest, for diet, for sleeping, just to get them started on their rehab protocol. So if you have ever suffered a concussion, make sure you seek a professional who has concussion training to diagnose you properly, to do all the proper tests on you to determine the severity of your injury. Thanks for staying tuned to our video. This is number 3 of our video series. Our next one, we're going to be talking about the rehab process and how we take people from concussion to return to play, whether they're in a sporting injury or back at work or whatever the case may be. We try and go through a step-by-step research protocol to help them. Thank you very much.